Understanding blood pressure. In Gates, around 6 out of 10 people who have high blood pressure could have prevented this with lifestyle changes. What we are going to learn. What is blood pressure? How is blood pressure measured? And what do blood pressure readings mean? What is blood pressure? Your heart is a muscle that pumps blood around your body. When your heart beats, the blood is moving. This is your pulse. The blood presses on the sides of your arteries when it moves. This is called blood pressure. Your blood pressure changes throughout the day. How do we measure blood pressure? We measure in two readings, EJ 120 over 80. Top number, EJ 120, systolic, measures the pressure in your arteries when your heart beats. The bottom number, EJ 80, diastolic, measures the pressure in your arteries when your heart rests beneath beats. Normal blood pressure is between 100 to 139 and 60 to 89. How is blood pressure tested? This is done with the measuring device with an arm cuff attached to it. The cuff is wrapped around your upper arm and filled with air until tight. It can feel uncomfortable but only lasts a few seconds. It is important to relax and not talk during this time because this is when the pressure is measured. You should get the results straight away on the display.
3.
Hello, I'm Sean. I'm here with Skills to Work taking part in the cardiovascular project. As part of this project, we've been taking people's blood pressure to see if they're high or low or just right. The blood pressure is measured by this machine right here. Basically, this is what goes on your arm. Left arm's the preferred method because that's like the closest to your heart. And then this machine is what measures your blood pressure. Once it's done its measurements, you'll see like two numbers, like say for example 120 over 80, and then it measures on how your blood pressure is. So I will now demonstrate this machine.
It is important to use the correct size of cuff. The arm is measured around the center of the bicep, like this. We can use this chart along with the bicep measurement to work out which cuff to use.
Right, so this is how the blood pressure measure will take, and it goes up on the arm, up to the height, onto the shoulder. You then strap it in until to the point where it's tight enough to strap on. Then once that's ready, you basically press this button and it'll begin the measurements. What'll happen is it'll give a tight squeeze. It'll be like a tight squeezing sensation on the arm, and that'll be how it measures your pressure. There we go. So it's 117 over 67, which is healthy. So as you can see, 117 over 7 worked out against that is a healthy status on both ends, the systolic and the diastolic.